Hello everyone, welcome to my channel. Today I'm going to show you something really special, a complete hospital management system that are built for clinics and hospitals. Now I know what you are thinking. Hospital software, that sounds complicated, but trust me, by the end of this video, you will see that anyone can use this application, whether you are a doctor, a nurse, a receptionist, or you work in pharmacy. This is a awesome design for you. And let me tell you a quick story. Last month, I visited a small clinic in um, in Lagos, and I saw the receptionist struggling with three different notebooks, uh, one for appointment, one for payment, and one for patient records. The doctor was writing prescription on paper, and the pharmacy didn't know which medicines were running out of stock. It was a chaos. And that is exactly why I built this system. Everything is in one place. No confusion, no lost paper, no mistakes. So today I'm going to show you exactly how this works. We're going to follow two patients through the entire process. First, we will see a regular patient coming for consultation. Then we see someone who needs to be admitted to the ward. Um, this application is really awesome. And what makes it special is that it works offline on your local network. No monthly fees or cloud subscription, complete data privacy. Uh, your data stays with you and easy to use for technical staff. So who is this for? The doctor, the nurses, the receptionist, pharmacist, lab technician, radiographer, accountant, and hospital administrators. Um, so to use this, it's very simple. So what we do is this: we we like the system has 10 users roles, each with specific permission. What you are seeing on board now is a super admin. The super admin has a complete system control, can delete um, records. So if you look at this super admin, a lot of things is in there for the super. Okay, this is the system administrator. I think let me log in. Let me show you the super admin interface. This is super admin interface. So the one we just saw was just the lower admin interface. So this is the super admin interface. So the super admin interface in the dashboard, we have the users management, where the super admin manager users role. Uh, from so here, the super admin can disable any of the staff, any users, can reset the password, delete. So this is what the super admin does here. So so this is where the super admin can do that. Then we have also patient records. Super admin have full power to delete any patient record, including those with paid invoices, dispense medication, or completed or lab radiology results. So this is where we can reset. Super admin here can delete the patient record. This is where the super admin manages patient records. So it can delete the patient, the recent visit. Let's say it can reset a visit for a day, then it will just delete the all the medication for the patient and all the other business transaction for that day only. So this one will delete all the consultations, all the medical records, and everything about that patient in the EMR. So this is how it works. So we have the staff management. This is the super admin can also add staff. So super admin can come here and add staff, then select department uh, for that staff. Um, we have also patient. Okay, we have yes, like I've said, we can also come here. The invoice. This is where this one manage invoice. We can. So I can have power to cancel any invoice, including pay once. Uh, they can void all payment, revert link request to pending status, and keep record for audit purposes. So we also have system settings. This is where the super admin set a amount for the different card type that are being paid for in the hospital, the personal card, the family card, then the lab, if there's any consultation fee for lab or rad or the eye clinic, this is where the super admin sets those details or information. So we also have the hospital information. Like in this application, the the hospital information, the hospital name. This is where the super admin can alter. You can see this place now. I have Rapid Healthcare Hospital. If I change this thing to, let's say, Rapid Healthcare Hospital, Rapid Healthcare Clinic, I come here, I save the setting. So if I refresh this page, you will see can see now. So every um, of this application, the name of this application or the name, this is where you configure the name of the the name of the clinic. So we have Rapid Healthcare now. I can see, and if you check here, let me check from other browser. Let me open this. So this you can see Rapid Healthcare Clinic instead of the hospital. So this is where we configure the hospital name. Um, so so we have a lot of things where the functionality. This is the system settings. So you can see here. So if I add like that hospital motto tagline, if I change this tagline, it will also reflect in the printout and every details pertaining to that hospital information. So this is where the super admin comes here, change the hospital information and it will reflect in every module. You can also add the phone number as well. So this is where the super admin. Then we have scheduler. I added a scheduler. Um, the So this is where the instead of us for like when you are installing this on the first in the first instance, you have to um, click the scheduler, then install a scheduler. This is very useful that when you want to create a automatic bed charges for every 24 hours. So instead of you writing code to create a task scheduler for that, you run this uh, very easy. So this is very easy. Instead of you writing code and doing all those stuff, you come here and then install the scheduler. Then once you install the scheduler, then scheduler started running. So scheduler, when you install the scheduler, Windows Task Scheduler entry code, hospital Laravel scheduler is created and it runs PHP artisan schedule run every minute. So you can see then. So that's what the scheduler does. So every minute, Laravel checks which schedule tasks are due to run admission bill beds. It runs every hour and creates a bed charges when admitted patients who have completed the 24-hour period. We'll see that in a moment. So this is how this. So we have said it. We say the system has different users. So we call them roles. So think of it like a restaurant. In a restaurant, you have the chef, the waiter, the cashier. Right? Everyone has their own. So um, we have the receptionist. The receptionist, the nurse, the doctor, the lab technician, the pharmacist, cash officers, radiographer, the eye specialist, the admin, the super admin. All these things are the roles here in this application. So receptionist, he or she is the first person patient meet and she registers them and books appointment. The nurse checks the patient blood pressure, temperature, and all that vital sign stuff. We'll look at that in a moment. Uh, Lab technician, if doctor says go check your blood, lab guy processes the test. The cash officer, very important, she collect all the payment, no payment, no services. That's how this application works. The radiographer for x-rays and scans, eye specialist for eye problem. The admin is the big boss who manages everything. The super admin, this is you. This is the super admin. So it's the hospital owner. You can control everything. So from here, we can control the staff management. As staff manage, you have a lot of you can delete invoice. You can even adjust. This is where super admin can apply funds discount in case where funds refunds are very necessary for patient to get refunded. This is where we carry out the refund, to apply the refund, and then it will automatically the um, the adjustment will be carried out. So, and here is the most important thing rule in this system: payment first, service after. So let me repeat: payment first, service after. Why? Because in many hospital, patients get the service and then disappear without paying. So this system, they must pay at the cash office before getting lab test, before getting the medicine. So no payment, the system won't allow the system, and it's very simple. So no payment, the system will allow the services. Very simple. So all right. Imagine, let's dive in. Let me log out. So imagine I'm Grace, the receptionist. A woman walks into the hospital. Her name is Adeze, and she's been having a fever for 3 days. The first thing I have to do is to register in the system. So, so let me log in as a receptionist. So I will log in as a receptionist. I think I have here the receptionist. Okay, good receptionist. Let me log in. I've saved the credentials in my browser. So I log in here as a receptionist. So so like I said the first thing I have to do is to register her in the system. So the receptionist come here to register the patient. So we have different card type. We have the personal card 25, family card 5,000, emergency card family card 5,000 naira, the emergency card 5,000 naira, while the personal card is 25. So let's say this patient is coming to maybe for the first time of visiting the hospital or with us here. So she will come here and then purchase a card of personal card 5,000. So Adezi. So good morning. So what is your name? I'll ask as a receptionist. It's okay, Adezi Okafo. Then I click Adezi. Adezi. So the last name Okafo is a surname Okafo. So the date of birth, let's say March, let's say any date of birth, sure. So let's give out the date of birth. So we call maybe the day is 15 and then 1985. So that means you have to be 41 years now, or thereabout. So phone number, if there's any phone number, is phone number, which is very important. So the phone number, if there's address optional, the address can be, let's say, Opika Street. All right, Opika Street. So the cash office, the receptionist can now come here. Then receptionist, here we skip the block group. So if there's any block group, or if you know, but that you can select any of the type of block. If there's none, just leave it and then register the patient. So you can click confirm. So the UMA an ID number will be created for this patient. So the patient will be required to take this ID number, and then with the cash office, the reception direct her to the cash officer to make a payment so that you can activate this number. So 2,500. Now at the cash office, okay, let me see. So let's see receptionist. Let me check the number. Let's check the number. Receptionist. Okay, Adeze Okafo. So this is the number. So Adeze Okafo will go and see the cash office with this credential. All right. So at the cash office, so the cash officer comes here and then enter the ID. Okay. So Adeze, what's your ID? Adeze supply her ID. So okay, it's okay. Adeze Okafo. So she comes here and mark confirm the payment, then you can record that payment. So this card has been activated. So at the cash office, I've entered this 25. So the patient now can now proceed to see the receptionist. So for the receptionist to create appointment for her with the doctor. So so in this hospital, new patient must pay a ration card fee. So so we have told her to go to the cash office over there and pay that amount. So after payment, they came back and the reception will book appointment uh, with her with the doctor. So now she's back with her receipt. Now let us book her appointment. So once she comes here, the receptionist comes here. The receptionist comes here, book, select department. Say want to see the general medicine doctor. Which of the doctor is available? This is doctor. Then what today? Okay. Then click book. So once you book the patient, the nurse. So this is where the nurse comes in now. Now he has booked uh, Adeze Okafo. Adeze Okafo is waiting to see the doctor, but um, she will need to be directed to the nurse for the nurse to carry out their to check vitals. So now let's log in. Let's log in. So the reception asks the patient to go and see the nurse. So let's see the nurse. This is nurse the credential. So now the nurse has this is nurse panel. So the nurse now comes here and then sees there's a awaiting patient for vital, then the nurse record the vital signs. So let's record the vital signs. Okay, just let's give anyhow 67, let's say 110, let's say oxygen saturation 96. If there's any note, any observation or concern, you enter it here. Then you save the vital signs. Now, once the vital signs have been saved, then the receptionist can now call the receptionist can now direct the patient to go and see the doctor. So the reception will come here and you can see this beautiful interface. This is live keyboard. This is where the receptionist manages queue, and then this status always shows where the patient is in the at the hospital, which department, which staff or department the patient is currently in. So if it's with the doctor, it will say doctor. Then now let's see this patient now. So the reception can now call this doctor, tell this patient, okay, at this you can now go and see the doctor. You can see the status have changed to with doctor. So it comes here. Then so doctor login. So this is what doctor will see. So Adesu Okafor, um, so after the Adesu Okafor have take a vital sign with the nurse, then the she has been directed to see the doctor. So Doctor Chukwu Emmanuel sees all her details. So Dr. Chukwu Emmanuel will come here, and it's okay. Dr. Chukwu Emmanuel can also type the ID here. So once he comes, it's okay. Let me see your ID. All right. Look at this Okafor. So we can continue with the consultation here. You can see now. So Dr. Chukwu can now see all the vital signs already being recorded by the nurse. So he doesn't need to check again. Just look at it, and then what doctor now does is to enter the symptoms of the patient. Okay, what are your symptoms? Okay, Adesi, how is it? What are you complaining of? Okay, headache, fever, something like that. Examination finding. Okay, maybe after the lab or something like that. So let me check diagnosis. Maybe the doctor treatment plan, if there's any, but if there's no, doctor can save this consultation window form. Then you can now refer the patient to lab. So so doctor can ask, okay, click on this lab. So now as so doctor have seen, okay, based on the uh, 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 complaint, then doctor can now say, okay, so doctor can now um, doctor can now say, okay, based on the complaint, uh, doctor can suspect, okay, malaria, but he will need the doctor will need to confirm with blood test. So he's going to order some tests for the for Mrs. Adeze. So let's say malaria test. So doctor can come here and say, okay, malaria parasite. Can see the amount. Then the WIDA test. Come here and then say WIDA test. All right. Okay, it could be full blood count. Take a full blood count. You can see the amount. So you can see that I selected the items and the amount here. So top of 10,000 naira. Then you click submit. So the system shows 10,000 naira. So this patient will know there's a way up to pay this for this service item before going to for the lab. So confirm. So now doctor can now close the window and now set the patient to go and make the payment. So uh, so she goes to the cash office. So at the cash office, this is what happened at the cash office. So the cash office madam look at it here. Say, okay, well, this is very nice. So the cash office madam enter the ID as usual, and then you will see this and then bill now. The cash officer and re-enter the patient ID and look at the items to bill, 10,000, create invoice, then the cash officer record the payment. So you can see the payment for today. You can see the one for registration and the 10,000 naira for the lab. So if you come to the payment table here, the cash officer can see the items that are paid for. See the item that are, and it's an outpatient. These are the patient that comes to see doctor and work. They're working patient. They are not those ones that are admitted. We are going to look into the admitted patient case. So these are just working patients. Okay, these are the lab services, and you have paid for it. So good. So the lab. So since Ades has paid for that for those lab service, so the accountant cannot direct her to go for the lab. So they go to the lab to take. They will take. They will go to the lab. So that lab man will take their blood sample. So let's see what happened at the lab. And there's one thing I wanted to show, but I skip it. I didn't mean there's no way if the patient now maybe refuse to go to the lab account office to make payment and go to the lab, the lab man will not see the record. So will not see the records of the of Mrs. Adeze. So let's see what happened at the lab man. So the lab man. So lab, this is lab credential. So the lab man comes here. So the lab man comes here and then look at the sample. Adeze Okafor. He or she can come here and then type the what do you call it, the ID of the patient. But now let's just see here. You can see the collect sample. You collect the sample, start entering the result, they enter the result. So the lab man comes here and enter the results here. So I've created a very awesome interface where instead of manually entering the what do you call it, so instead of entering it, they can create a table. So they can give this table their what do you call it, the rows and their columns. Very, very awesome. Very awesome. So instead of the lab man entering the result this way, or something entering that result this way, so the lab man can just come here and then make use of this table. So can come here and create a table. Let's say 3 row, 3 column. The lab man can give maybe test. Sorry, test. If there's test, maybe the results. Sorry, results. If there's so lab people, lab man, better know. I'm not a lab technician or a lab scientist. So task results, and then you give maybe if there's a recommendation or output or something like that, then you can come here and create another table if you want to. You can create another table. You can give maybe this one, another row, another column, 2 column inside the table. This could be maybe results. Sorry, this could be recommendation. Recommendation. This could be a remark. Remark. So you just enter it clearly. This how the interface for the labman remarks. So something like that, something like this. You can add whatever you want to add, then give you your this thing. Then you can send your result to doctor. Save and send to doctor. So when the labman has finished entering result, then Adeze can now go and can come back to see the doctor. Okay, so the doctor comes here, doc. So Adeze has returned, should be returned. So you can say returned. So Adeze has returned. Doctor continue with the consultation. Continue. Okay, Adeze has returned. This is the RS for drugs. This is for lab. He has completed this lab test. So the doctor comes here, lab results. You check the lab results. This is where the doctor can view the lab result. So you can see the table. This is very awesome. You can see the table. So if there's anything, this is where the table will appear. I didn't enter anything on that result. That's why the table is empty. So the lab man will fill in the test and the result recommendation or normal range of the remarks in this table to appear on the doctor side. So um, so the lab man now can now create a prescription. So like I've said, there are many windows. So the doctor can now make a prescription. So doctor can now say, okay, based on the lab test, you can now say, okay, let me prescribe make a prescription for the patient. So so uh, so the lab man can now prescribe medicine. So let's say we have I have some medicine here. These are just for example. All these medicine are medicine that are loaded from the farmer. Let's check from the farmer inventory. So from the pharmacy. So let's check the pharmacy. So see pharmacy. So this is pharmacy panel. You can see the pharmacy panel, the prescription, the inventory. So you can see the pharmacy. This is where the farmer add medicine. You can see. So we have price list, base price list. We have the stock level. We have the stock total, the name of the drugs, the category, the stock, and the order level, the price list. We have the price for the inpatient, those that admitted, and the outpatient, those walking that come in and then go, they're not being admitted. So we have the price list for all these drugs. So different price list for inpatient is different from the outpatient. This is where the farmer adjust stock. So they can add stock, they can add or remove stock. This is where they can adjust the unit in bulk or individually. So we also have edit. So this is where they can edit. So if it's amoxicillin, they give us the amoxicillin, the drug type category, the antibiotics, CPTs, and then how many the bulk unit. So like if it's in bulk, if it's in tablet, in that tablet, how many of those uh, tab do we have in that pack? So let's say like I say, we have about 470 of them in that a total number of tablets we have so far. So let's say if you have tablet, you can define tablet unit per pack, maybe one in each pack or 10 in 10 tablets in each pack. So you give us the tablet amount of each tablet, which is 150 uh, naira, no, 150 naira. That's the base price. 150 naira. So we have the inpatient price. You define the inpatient cost here. The outpatient price. I think the inpatient is always higher than the outpatient. So it tells us the total number of stock quantity. So that give us this one give us total number of quantity for that drug 470. So that 470 tablets. So when this number of tablet comes low, this is the reorder level. Once it's about 50, then you can now create a can now reorder. So I've set a reorder limit of let's say 50. Then enter the expiry date. So then enter the expiry date, and that's how it works. Very, very simple. Very simple. So you have something like that. Then the farmer also can also like we added some things like the farmer. So it's not only medicine that are being prescribed by doctor. Farmer can also create a customer register first in customer like can also prescribe a drug. Then for those that come from outside to make purchase, buy medicine or drug without seeing doctor, this is the window for that. Very, very awesome. So so we have a window for such. So the farmer can come here and say, okay, so something like that, blah 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 blah, the phone number. They register the patient, and then they can create a CIS. They enter the medicine. They can select the medicine here. So like if I say testing, I think I have testing drug. I did some testing. You can see the amount here, 250. So they come here, then do whatever the amount. If it's 250, how many quantity? They say the tablet you want to give the patient 5 tablets, it calculate the amount for you. So when they create this, they go to the cash office to make payment before the farmer now dispense the drugs. So you can see all inventory. We have a lot of the sales ledger. The farmer also has a good, very awesome sales ledger. So to generate the sales report for the month for today, uh, very, very awesome. All right. So let's close this. Let's see what is happening at the doctor hand. So the I think sorry, the doctor. So the doctor comes here. Doctor. So doctor now creates a prescription for Mrs. Ades Okafor. So doctor makes a prescription. So product makes prepare the prescription. So let's say that testing I said the other time. We have about testing and look at where I did what happened. So we have different price lists. This is for outpatients, and this patient is an outpatient. Is a patient that comes to see doctor and then work out. So we have to toggle this price. You can see inpatient. There is a different price list for outpatient and inpatient. So if I have outpatient, you can see the price list here. So we have stock of 496 for inpatient 300. So this is for outpatient. So the doctor have to toggle this and toggle 40 the medicine. Then select how many what they call it uh, days, how many times frequency, maybe for 3 days. Then the quantity. Let's say if the doctor now, let's say make a mistake and then select 5,000, and we don't have 5,000 in the pharmacy stock. Once you want to create a position, say you must add, okay, can see now. So there is no how we can then have it like that. So yeah, it's more than. So let's say we have about five, then doctor can now create a prescription. You see, add at least one medication. Sorry, we have not added any medication. Sorry. So dosage, let's say let's say 500. I'm just not a doctor. Then let's say the doctor want to say put 5,000. Then once you click 5,000, you see at the alert insufficient stock cannot create precision insufficient. So follow medicine. So the requested was 5,000, but what is was actually in that store is 4,963 tablets. That's awesome. That's awesome. So that one will now make the uh, what they call it, the doctor now to come down and say, okay, we don't have enough of this stock. So doctor can now say, okay, let me give you 10. So once you create this prescription, this is just testing prescription. So it gives the doctor a confirmation window. This is a confirmation, prescription, and pricing window. So doctor can now confirm that this patient indeed want to make 2,500. That's total cost for the drugs. So if the doctor still want to add, doctor can also come here and add medicine. So doctor can come here and add. Let's say if you see this same amoxicillin, then they give us how many ones. I'm not a doctor, so doctor knows best here. How many days? 2 days. Uh, amount quantity, and I know I think it should be 3 by 3 by I don't know times 3 by 9 or from the quantity. I don't know. So these are how they multiply, and they have their own the quantity that should be. So let's see. So once they multiply all these things, let's say you want to get the doctor now say okay 20 quantities. So then doctor now create a prescription, can see the cost 7,500. They click confirm. So the prescription has been created at total 7,500. So at this they have to go and pay 7,500 cash office before going to see the pharmacy. So accounts. So it goes to the cash office. So the cash office now comes there of the payment. See the amount for the consider. These are the drugs bought for. And Daisy, Cancina, test 10, amoxicillin 25,000. This is the total amount. So the cash office create and record the invoice. So that's how it happened. So that's how it works rather. So the yes makes so once the has makes the patient has paid for the drugs. So at the pharmacy, this is what happened at the pharmacy. So at the pharmacy, so the pharmacy comes here, and a pharmacy will see the patient details. Now that he or she has paid the this has paid that pay for her drugs. So pharmacy can see all the drugs. You can see 75. There's quantity. Okay, amoxicillin 5,000 sales amount. Then once you confirm this payment, you will see from the stock level. The stock level will just adjust. The total inventory cost price of all the 11 medicines so far we have loaded. So once you click here, they come here and then dispense. Then click 7,000, confirm. So medicine has the stock level has adjusted. As you can see now. So now, let's see what the receptionist is here now. So the receptionist come here. Receptionist comes here and see the patient. Okay, can see now. Can see Adezuka for pharmacy working. So pharmacy. Uh, so that's how he went to the. So he's still at the pharmacy. So the pharmacy now comes. The pharmacy click dispense. So where is that pharmacy? So pharmacy. All right. Okay. So it has dispensed the prescription. You can see dispense. They can also view what they have dispensed. This is awesome. They can also print it. I can see now using that same name, hospital name I've changed. You can see you can adjust this from that settings, system settings. So you have something like that. This is awesome. So now this is for an out patient. Now, if you look at the what they call it at the receptionist, like I've told you, we have other services. It's not only patient coming to see the doctor. We also have those that this is for booking if we have already an existing patient. So like if that's that same days, if you have an existing patient, not a new patient, you can book rather instead of you telling the patient or asking the patient to go and make a card purchase uh, or to see the doctor for the cash officer for emergency card already. Don't do that. Since an existing patient, you just follow from you just book appointment directly. Then we have other one for lab working. There are some customers or patient that comes to see the lab without going to meet the doctor. So this is where the receptionist can come here and register them. You can register them if it's an existing patient, if it's a new patient, just register the patient. Then register them here. So they come here, bam, 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 just register them. And then automatically the patient now will better be available for them to see the lab uh, personnel. So the lab personnel can now do the test without the patient going to see the doctor. So I also included that feature. Okay. So we have also have for eye clinic. We have radiology. So we also the same thing. There are some patient too that comes to see the working patient. So they come, they don't want to see the doctor. They just want to see the radio, the radiographer. So what the radiographer now does, what the receptionist works in, you have to register them. They register their name. Then once they register, they let's use this as an example. They register and also select those services they intend to come for. Let's say, let me use somebody like Obi, and let me use fictitious date of birth. Date of birth. So date of birth, fictitious date of birth. So let me use 2021 or something like that. Let me use something like 1999. Okay, just rem split. So what um, the receptionist does is to register this patient, and they say radiology no card required, so they click OK. So they have to select those services they come for. So if it's abdominal scan they want to do, they just complain. Then the receptionist okay. They give reasons why they are coming. If it's ECG, they give. So they click radiology book. So almost be radiology also be settled. So direct them to pay to cash office. They are not going to pay radiology 15,000 total 15,000. Okay, that is the services. They are not paying any consultation fee. It's just the services they selected. So they have to pay this for that service 50,000 before they can meet the radiographer. So they click OK. They click OK. So that's how that one works. So Omo Obi have to go and make for that payment. So when they go to the what they call it, the what they call the account. So the account woman comes here. These are working patient that comes to see the rad man. without they don't want to see the doctor. So they just want to see the radman. So that's how they are on. So they come for this radiology, pending request radiology, or more B. They click bill. So I think 15,000 for that scan. Patient ID misspelled. Okay, I didn't enter. Please verify the correct patient ID. So I have to, I have, let me check from the receptionist side. Let me check from the receptionist side and then see the receptionist side. Receptionist side. Let me see the correct ID. Correct ID. Okay, this is the correct ID, RAD 22026. So the patient have to go with the RAD ID. So account. So they log in here. So you can see now that's the correct RAD. So they enter bill now. So you can see the services. They create invoice. They record their payment. So that payment is recorded and then also recorded in the payment table as well for the day, which is awesome. You can see the sales ledger for the cash woman or cash officer. So they can print their sales ledger here. So far, so good. These are what they have done for this month, 35,000 naira. This is just for 1 month of the following month to the other month. This one is for the current month. This is wonderful. They can also export to Excel and all those stuff. This is a very awesome application. So this is what happened. So at the RAD end, so the RAD man, what a RAD man will do is that RAD man comes here. The RAD man can now enter the patient ID and then follow the patient has paid. So they can start their enter results and whatever have you. These are patient that comes to see doctor. They enter their result and then complete and send them their reports. So let's log out. So this is where also the RADMAN can also create their own catalog list. The lab also has this feature. So this is for the lab. This is for the RAD, radiology, service catalog management. The lab man also has the same thing. I'm using the RAD as an example. So let's log out. So we're going to look at quickly. Let's look at the case of an admitted patient. Um, like admitted patient, um, let's come in as a receptionist. Let's say receptionist comes here. Want to look into okay. So let's look at for an admitted patient. So like we have said, we have seen before. Now we have seen what's happened. The patient, the one we saw, uh, the Adezi have gone to see the pharmacy. She has paid. She can see her prescription. Then when the pharmacy click dispense, watch what happened. The system automatically removes these drugs from the inventory. So everything's automatic. There's no manual counting later. So this is how it works. So let's look at like the admitted patient. Remember, we have so let's say we have Dr. Emeka. So a new patient called let's say Emeka. Um, let's say his name is Emeka Mosu, and he's 56 years or something like that. He's very sick. He has a pneumonia. That's a serious lung infection. So after examining him, we realized that this man cannot go home. So we need to stay in the hospital. So you need you need bed rest and oxygen and antibiotics. So we decided to admit him. And we need to choose which ward and the hospital has different types. So this is what we do. So the receptionist comes here. Let's say if it's a new person, and then let's say comes here, it's an emergency situation, emergency card. You give the emergency card. Let's say the name is okay. Should I use? Let me use. Say her name is. His name is Emeka Nwosu. So Emeka Nwosu. So Emeka Nwosu. Right. So Emeka Nwosu, 1997, something like that. So the receptionist comes here and then give the address, partner last street. Patanla or Papala Street. So yeah, YouTube, please don't take down my video. These are fake people's details. So we click register. So they go to the cash office as usual to go and make a payment. So the cash office woman comes here, account. Cash officer comes here, account. So the cash officer now comes here, enter the sorry, it is not the patient ID. You need to get the correct patient ID from because the receptionist have to issue that current patient ID. So let's see what happened at the reception. So the receptionist comes here. Emeka wants to give her this Emeka number. This particular ID. Give it out to the patient and tell the patient to go to the cash office to make payment. So they at the cash office now. So they come here. They click search. So we come here. You can see now. So they have unpaid this. So I have to mark this card. So now that card has been activated, this emergency card. So the patient the receptionist can now book the patient to see the doctor. So they come here. Receptionist comes here, book, select doctor, general medicine doctor. This is the doctor available. If you have any other doctor, it will be listed here. For now, we have one doctor. Then if this is today, so constitution is for today. So now it's for today, like we have said, we refer the reception refers them to the patient, the doctor wants to meet the nurse. So nurse have to follow record the vital signs. So they record the vital signs. Right? So they record the vital signs. Say vital signs. Click OK. So once they click OK, they now log out. Then ask the patient to go and see the doctor. So the nurse now asks the patient to go and see the doctor. So nurse come here and click call, and then confirm call. So once they click confirm call, then doctor comes here at his own side. Doctor come here. This doctor set credentials. Doctor login. Doctor comes here and say, okay, this is Emeka Nwosu. Okay. Now, like I've said, if you look at it, doctor can also come here. These are all things we have done for today. All the completed tasks, doctor cannot delete. But if we have a pending lab test, doctor can delete, can edit. We will see that in a moment. So once we come here, so doctor, let's go to the appointment. The doctor comes here. Doctor says, okay, continue. Mekamosu. You can see all the vital signs recorded by the nurse. So how? Okay, fever, headache, something like that. These are the complaint. So doctor says, okay, well, there's no problem. Doctor, the examination findings will be later. Diagnosis, doctor can just keep this one, that's treatment plan, maybe until when the lab tests have been carried out. So doctor save this window. So doctor now can close this window. Since it's an admitted patient case, doctor comes to this admission. So once doctor comes to admission, so we have different ward. We can create as many ward. The admin will create many ward and beds. But I just decided to create this one here. But at the admin end there, that feature is available. So doctor comes here, request admission. So I think Sugar Daisy, Okafo, they can enter their ID here. So I think it's Adaze. It is Adaze Okafo. No, it's not Adaze Okafo. It should be Emeka Nwosu. So Emeka Nwosu, good. Now if it is a double word, we have about 1, 2, 3, 4, 5. All these word, the best have addresses. So we have, let's say, this particular one, this by then 15,000. The doctor selects one day and then click OK. You give reasons, maybe give them the weakness of the body or blah blah blah. Weakness of the body, something like that. Just give your this thing. Then select the day and then you create the admission request. So once they create this admission request, the patient have to go and make payment. So patient goes to go and make payment. So account comes in. So you can see now. So the cash officer have to enter the patient details and ID. You enter the ID. So since an admitted patient case, you can see because of their nature, they make a partial payment. It's an admitted patient, so they don't they pay the hospital collect deposit for them. So like we have said, the doctor have decided to admit them. They choose ward and we choose that particular ward with them, and then they have to make a kind of uh, so what the system will do is that you have to create admission number for them because now they make a part deposit. Let's say 15,000. The patient say, "Oh, sorry, I don't have up to that now." So can collect whatever the patient has, but make sure they must pay one or two things. So they pay. Let's say they pay 10,000 naira. 10,000 naira. Then cash officer can come in like this. Cash you can record by card. You can zip about transfer, whatever have you. Just have to state if it's bank transfer, you state if it is cash. You give us the details. So they record the payment. So since they've recorded that payment, you can see all the payment table history. So they record the payment. It will appear under the patient admission billing here. See now, the total charge was 15,000 naira, and they were admitted at this particular day. They are paid 10,000 naira. The cash officer can also view their details here. You see, we have added a feature where there's what they call automatic bed charges. So every 24 hours, this charge gets added. This 15,000 naira bed charge gets added. So it add to this total charges. So every 24 hours, we have 15,000 to it. But now we have only one 15,000 naira. So the payment history, this is where they make their payment. You can see all the payment log. The cash officer can also print the receipt here. So as they keep paying, making payment, they see the build up here. This is very awesome. Very awesome. And this is where that Laravel, that what they call a scheduler, comes into play. So we can also create a scheduler here so that automatically to handle this automatic bed charges. So the admin can come here. So the admin can come here and then create a scheduler. So can come here and create that scheduler. So that scheduler will run every 1 hour to check which schedule task are due to run. It runs every hour and create a bed charges for any admitted patient who have completed a 24-hour period. So this way, so we have to install this scheduler here. So let's install the scheduler. Confirm. See now, that Windows scheduler is installed. This is awesome. So this is how it works. So it's how it works. So our next run will now be 6/8/2026, 9 p.m. That will be the next scheduler run. That's awesome. So they come here. Now this is what is happening now. Let's refresh this page. Good. So at this side now, this is what is happening now. So 0 6 hours. So the next one will be 24 hours later. So that's how it works. Now, so now the doctor now, let's see what doctor sees. So doctor now come here. Doctor now can ask, okay, now we have created you have to go for lab. So doctor can come from that medical records. You can come to this is lab, this is X-ray, this is eye, this is for prescription of medicine. So if doctor come here under Emeka Nwosu, you can type the ID here. So once you come this lab here, you can come lab, click lab. So if it is fast blood sugar, good. Let's say the patient want to go for this fast blood sugar, okay? Let's say for HIV screening, fast blood sugar and HIV screening. So you can see 6,500. So doctor can now click send. So when they send, doctor can still edit or delete this thing. You can see here, they make am also. Doctor can edit, can view, can see now, can view, can delete it. If you come to this patient side, let me say, before the cash officer log this payment, let's say the cash, okay, account. So click, okay, can search. This is what happened here. So fast blood sugar. So they come here, they click. As long as they've not logged that payment, the doctor can still change this item, these items. So doctor come here, and that thing should be 6.5, I think. So doctor come here. Doctor can say, okay, oh, that thing is too much. This 6.5 is too much. Doctor can still come here and edit. Can see that edit window. So doctor can edit here. Doctor can also come lab result here. Can also come here. Let me check that lab. Can see now. Doctor can come here, lab edit. Can also delete it. If you delete it, it gets deleted. Okay, let me use the example. Let's delete this now. See, are you sure you want to delete this lab request from maker one? So this cannot be done. When you click confirm, it's gone. So you have deleted that lab request for. So even though the cash officer can come here, cash officer will no longer see that lab request. So doctor have to create another one. So you can see there's no any pending lab request here. There's no any pending. You can see now. So doctor will create another one. So doctor create another one. Doctor create another one. So doctor create another lab request. Doctor can make another lab request. The same thing happens to subscription too. It's not only for lab. So doctor can also come to this medical record. Then come here and create a lab. You can create X-ray. You can request for X-ray service made for this for lab. You make am also. Doctor can say, okay, just for 5,000 naira full block count. That's all. Then click send. So the lab woman comes here. And the account comes here. And then click OK. And that's all. So once you can see that the lab request is here, can see make am also, can see I'm 5,000 naira. See, this is awesome. So where they can come here and then click OK. That's all. So the same thing with the, so this is very, very awesome. Very, very awesome. So they keep adding. So once they keep adding, it keep adding to the what they call it, the this thing to make am also. So let's come here for the lab service. Let's say since the lab man, okay, since he has created for lab, that lab 5,000 naira, and then the patient need to pay. So they come here. That's okay. They want to pay. This is the one created by doctor. Doctor made the request. And that's the American wants to go and make a payment for the lab. So they come here. So this is 5,000 football plans. You create the invoice because it's an ADM. This is an admitted patient. So all charges are for admitted patient must be processed through admission billing. So they click confirm. It takes the cashier. So the cashier have to record this payment manually. So I have to record. So how much do you have? Because their payment is part by part. Sometimes most of these patients, admitted patient complain of they don't have enough money. So they pay. That is in one case is a gradual process payment. So let's say what do you now have now? This thing is cost 5,000 naira for lab. So okay, now I have 2,000 naira to pay. You can enter 2,000 naira. You indicate cash up. Shall have to indicate. Enter the reference of POS number. If it's by bank or check, you enter. Then you click record 2,000. So one that you can see added total charges. Now 2,000 naira. You can see now. So we have the amount paid to 2,000 naira and balance to 8,000. When you add them together, we're going to have this. So the bed charges keep adding automatically every day. So we did something like that. We just for just an example and just an example. So we have those kind of things here. So the doctor can also come here. Doc. Okay, under the I think under admission. So under the admission, they've created the bed. Okay, it was a mistake. So we created the, I don't think it's 2 days or they happened that days. But don't worry, it will automatically. It just it's just something. So it's supposed to be this date 2 days, but it's not 2 days. It was that Laravel that I ran. I that Laravel is supposed to be run before setting up this time. So before the first thing to do when you install this application, you run the Laravel app. So won't have this 2 days this thing. So that's what happened. So you set up the Laravel scheduler. Install of the Windows scheduler rather before these things. So this is very simple. So yeah, let's see what happened. So this is what is happening now. So uh, days paid. So something like that. Emeka Nwosu. So you have something like that. So you run the Laravel first. So once you run the Laravel, you won't have anything like this. So that's how it works. This is where we import history. If you have any manual record you want to import, they can. This is where they, I think from the receptionist. Receptionist comes here. Receptionist comes here. For you want to do data migration, so they can record, they can select the patient or register old patients, give them their name. If you have a manual record of all these things and you want to import into the EMR, this is where you follow. If you have personal card, enter their details and then register them. The doctor can have them in the EMR. That's what I did here. Okay. So, um, so we have something like that. So under the admission billing, we have things like this. So we can see the admission billing. See now. So this is last time. This is when they started. So forget about these days to admitted. It was I added what they call it. Just one day. You can see 15,000 naira. But what happened is that I'm supposed to install the what they call it the Windows scheduler before any other thing. So once you install the Windows scheduler, that will be this 2 days, and you can see it's still the same. But see what happened. So it said 15,000 naira, and this is 15,000 naira, which is okay. Just because of that, this thing, I'm supposed to run the scheduler first. Because if you create another one now, it's not going to have things like that. It's just that I created what they call it. I created this record before the running installing that Laravel that window scheduler. So this is working fine. That's working fine. So something like that. If we can even confirm that, let's say we have another case of a case of an admitted patient. Let's say we register patient 825. Let's call it blah 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 blah. Okay, think 01 02 1990 1990. So we have the phone number, something like that. So let's just quickly run a bamboo. So something like this, register, proceed to make payment. You go to payment office, go again, account. So account have to log this guy. Account have to log this person as an admitted. Want to use this one as an admitted patient. Confirm, good. The super admin can also destroy invoice. We have seen it. There's a way we can do super admin to destroy the invoice. So the receptionist can come here. So the receptionist can come here, can book this patient, general medicine, Dr. Chuku. So today, book. So we have seen it. So you can see what happened here. So all my record got cleared here is because of I'm recording this video 12 a.m. You can see. So once it moves to 12, because we have 12:09 a.m. This is how I'm recording midnight. So once it goes to another day, it clears the table. So that's why you cannot see other patient details here. So we can ask the nurse to this time around, instead of asking the nurse, we just want to demonstrate something. So confirm. So let's say doctor comes here. Doctor now takes the vital sign. So doctor, let's jump that of nurse. So doctor take the vital signs. Doctor. So doctor have to take those vital signs since we decided to jump the 67, the come the system, but just giving some things to show why, to tell you that was a K96, something like that, 90. So save new, enter diagnosis. Okay, we have to enter the diagnosis. Blah blah blah. Examination finding, diagnosis. All right. To very so treatment plan, if there is any. So please save new. So doctor now say, okay, this patient have to be request admission. You have to request admission for this patient. Ola should be Ola Kemo. Okay, let's use because that the other bed is in use. I think let's use this one. So we select day one. To select day one, 15,000. You give reasons, maybe weakness or something like that. Just give weakness. So create admission. You can see. So create admission. So we create the admission for that patient. So create admission for that person. They have to go and make that payment for it to be visible. So once you come here, we have already admitted patient case here. I think we have admitted patient Emeka also. So this guy have to go to cash office. Have to go to account to make the what they call it, this particular deposit. So you have to go to, is it correct ID? Okay, good. So let's say they have 5,000 to make and they intend to pay by bank transfer. Record payment 5,000 recorded. So under the admission billing for the, you can see 1 day. See now, Orakemo for 1 day. So this is how it happened. So 5,000 total, 5,000 balance to 10,000. This is awesome. So it's can see set up the Laravel, the window scheduler first, and then you start working. So that's how it works. This is a very awesome application, and then yes, this is where the nurse add their daily notes. So let's see the doctor. Doctor gave this because I have a lot of features here. The under the admission billing, nurse the doctor can add pay their procedure, can add a procedure. So once let's say because sometimes admitted patients there are some other costs too, like procedural costs. So that are involved. Then they also have a doctor also take a note, so a progress note. So this is where doctor enter their progress note. The nurse also have their own progress note because this thing also comes with their note taking. So doctor can enter the procedural cost here, the add cost here. They tell us, okay, is it in what they involved during that operation or surgery or during the admission, good dressing, enter us, give us the procedural name, enter the course here. So whatever the course you enter, let's say you enter the injection, maybe you put intramuscular, and then give us the description, give the description. You give the cost, let's say you spend about 2,000 naira, then you come here, and then you click add procedure. It will be added to the patient total. You can see it's added. Then this procedure too, they can also edit this procedure. They can edit it, change the amount because doctor can make a mistake in the course of adding the procedural cost. So you can edit and then update the procedure. You can also delete it. So this is where they enter that. They have their own notes. Doctor add their own progress note. They add daily notes. This is where they enter their own daily notes. They take their daily notes. The nurse also have that feature too, where they also take their own daily note. So the nurse has a written good note, patient is stable, and they give them they write that note, they write some notes telling me okay, the patient is stable, we need to continue treatment. So then they keep adding those things. The nurse has their own daily. I think we have the nurse. The nurse also have that feature too. The nurse. So whatever they enter, the doctor can see, but they cannot edit what they can see for admitted patients. You have two admitted patients here. So this nurse that is logging will see this thing. So they will come here and then view all the notes. They can add their own notes. So they can add notes. Nurse can also add their own notes. They can add notes, but they cannot uh, edit what they have added. They add the note, they keep adding. You can add and view all notes. Now they don't have any notes here now. So that's how it works. So they add those notes, and that is how this application works. So the we have already all right. We have already covered a lot today. So let me summarize what you have learned. Um, One, the patient registration, receptionist register, books appointment. Uh, the nurse checks blood pressure, temperature before doctor. The doctor consultation. The doctor examines, diagnoses, order tests, and prescribes. Four, payment first. Patient must pay at cash office before services. Laboratory, lab processes tests, enter results. Six, pharmacy. Pharmacy dispenses medicine, inventory automatically updated. Uh, Admission, doctor admits patient, family uh, pays deposit, patient get bed. Ward management, nurse write daily notes, doctor adds treatment. Doctor discharge family, pays balance, and patient goes home. So we have seen in that AOK, this is where when they finish, doctor can come here and then think where is doctor. So and this is where doctor comes here to discharge the patient. Think under admission. Once they are finished with this amount, once they are through with the doctor comes here and discharge. But now he cannot discharge because this total charges and these are not the same. So total paid must balance with total charges before they can discharge. And if there is any what they call it any previous payment before, maybe so at times there are some mistakes doctor can just before uh, creating these bed charges. Doctor must have maybe uh, allow the patient or maybe uh, uh, um, um, kind of what will I call it, treat that patient and outpatient before, make payment, and then realize that oh, I'm supposed to create admission or I'm supposed to prepare create a ward or admission request for this patient. This is EMR as a way to track that relationship. It will appear on this doctor panel here. I think it's under should be under view. So if there are other previous what they call it charges before this creation of admission bed, it will appear here. So doctor will just click, just click that radio button, and it will just append link all those existing previous charges to the patient billing. This is very awesome. So I've said reports. So this is a complete financial tracking and inventory management, and a lot of features are there. The Oluwa admin can also download the backup and some other things. There are some other things here, if for the sake of time. So it's a very wide, awesome stuff. So the lower admin can do backup and then come. This is the lower admin. They can download this backup. It goes to the Google Drive. They can restore their backup. They can also change settings. They can also do many things here: medical record, staff record, and staff, and then just manage staff details. Um, so that's how it work. So thank you so much. Like I've said, if you download and install, uh, I have a special offer. If you download and install within these next 7 days, I will give you free installation support, 1 hour of staff training and Zoom call, 30 days free technical support. Just email me after downloading. I would also like you to smash the like button, subscribe and turn on notification. Comment below, tell me which part of you find most useful. share with other hospital owners. Thank you so much for watching, and I will see you in the next video where I will show you how to install this on multiple computers in your hospital network. God bless you, and God bless your hospital.